Thank you so much. Welcome back.
Thank you, Faith. It's good to be back.
Tell me about Gabon. I think that this is absolutely fascinating. You were in Gabon in June, right? In 1 week, you performed about 88 surgeries. How is that even humanly possible? What did you do?
So thank you for having us. Thanks to the volunteers, we had 17 volunteers from about 4 different countries, 3 different continents. With the help of the Obeng Foundation, we were able to recruit the best volunteers, and we were able to do 88 surgeries in a matter of 4.5 days. We evaluated over 160 patients, and 88 were candidates. We did the first gender reassignment surgery in a true hermaphrodite, a 28-year-old who just recently left the hospital about a week ago. So it's one of the most successful trips we have made, and thanks to people like you for spreading the word, and to the Obeng Foundation, this was a possibility.
Let's talk a little bit about the realities that we face. I mean, a lot of times we speak about the reconstructive surgery, the cosmetic surgery efforts, etc. And it sounds very airy-fairy, to be honest with you, because people don't necessarily understand the intricacies that are involved in this and the realities that actually, as the African continent we face, where healthcare is actually concerned. So tell us about that.
No, the healthcare is still at its infancy in Africa, and it shouldn't be. It shouldn't be because we have so much wealth. But we lack the education. When I say education, not the education that we need to do our job, but the fact that we don't prioritize healthcare. You know, healthcare is something that we always put on the back burner. You know, we put more emphasis on sports than healthcare. And we forget that a healthy nation is a wealthy nation. When people are healthy, they work harder, they can contribute to the GDP, and the economy gets better. So I think we need to re-educate ourselves, and this starts with our leaders. Educating the leaders, knowing that, you know what, when you are sick in the middle of the night, you go to your own community hospital, there are no oxygens. Many notable African leaders, parliamentarians, you know, have died because of lack of basic oxygen in hospitals. Maybe not in South Africa. This has happened in Ghana, Nigeria, all the other neighboring countries. I can tell you so many stories about people who have approached me talking about, we went to the hospital, there was no oxygen. We went to the hospital, they did not have antibiotics. I have to go buy my own antibiotics and bring it. So, yes, healthcare has a lot to do, and we have a lot to do when it comes to healthcare.
I actually say it's sickening, for lack of a better term, to know that actually when it comes to healthcare, we're really sitting at the bottom of the pile as the continent in itself. And what is even more sickening is the fact that a lot of those individuals that can afford good healthcare, quality healthcare, choose to go overseas to actually get any form of healthcare.
Which is true, you know, and it's sad because these same people, are the same. They use the same African doctors. Okay, there are more doctors. There are more Ghanaian doctors in New York City than in Ghana itself. And these are very staggering numbers. Okay, Uganda has a population of 50 million. I was there when I left here last time I was here. They have 10 plastic surgery, which is great. Okay, Ghana has about 12. Now, when I first started going to Ghana, Ghana had 5 plastic surgeons. But it's part of the education. You know, I was able to touch a few doctors in Ghana who are not plastic surgeons. Gabon, for example, doesn't have a plastic surgeon.
At all?
At all, for 2 million people. Togo doesn't have 11 million people. You know, the numbers goes, and it's not just plastic surgery. Plastic surgery is second tier. You know, when it comes to healthcare, of course, there are more important specialties that I truly believe that every nation should have one, and that's cardiac surgeons, heart health, neurosurgeons. Gabon doesn't have a heart surgeon. And I'm working with them. I'm working with them so that we can develop a heart surgery center.
Why? I have to ask you this question. Why? Why is it that, I mean, you're from Gabon right now, right? And then you had pharmaceutical plants in Ghana. This is why. Why is it that we've got countries on the African continent that do not have surgeons? Like, it baffles my mind. Is it because there's the promise of greener pastures that we're chasing after here?
It is baffling to me as well. But I think our emphasis are very misplaced. Okay, we put emphasis on things that, to me, because maybe I'm biased because I'm a doctor, it does not make sense. Ghana, for example, I remember the World Cup, I had to fly money to Brazil to give to players. You know, it goes to tells you how we think. Okay, every country, I think every country should have a basic infrastructure when it comes to healthcare. They should have the basic medical personnel in every major specialty: general surgery, orthopedic surgery, plastic surgery, neurosurgery, cardiac surgery. Of course, your gynecologists and obstetricians, the basic. These are not, you know, exoteric specialists that every country should have. It's like going to play soccer. Everybody should have a defender, a midfielder, the finishers. And we don't do that. We don't think about that. That's it's the same as like building a team. And this is one of the things that we do. It's not because we are not smart. We are, but we don't have the education. I know Gabon used to send. Of course, they still send patients here to South Africa. They send patients to Morocco, Paris, France, and Belgium. Okay, it cost the country about $12 million. These were numbers that were given to me about 3 years ago. That's one of the issues. I mean, one country problem. Ghana, for example, we lack some medical specialists. In every community should have one of these basic specialists, so that the big cities are not congested when it comes to patient flow.
Well, are people buying into this? Are investors coming to the party and saying, you know what, Michael, we're going to actually donate to the cause or contribute in some way to the cause?
So it's different. Of course, the charity programs can only do so much. We're in Gabon for 1 week. I can't leave my job and come live here for a whole year. Okay, I have my own personal commitments. But of course, we can do something like I'm doing in Gabon right now, that we are bringing Western practitioners to live in Gabon and train them. Of course, you have to pay them, but you know what? It's investing in human capital. And this is the beginning of Global Health Solution consulting firm I founded about 3 years ago. And I'm working in Gabon, I'm working in Uganda to train them to do microsurgery. So, whenever I go to a country through Restore, you get to meet people, you get to identify their healthcare issues. And global health comes in to try to solve some of those issues. So, yes, the private sector can help, but I think, of course, government also needs to start to paying attention to it.
It starts off with political will, Dr. Michael. We're going to have to leave our conversation there, but always a pleasure speaking to you and just listening into how exactly you are changing the continent. I think one patient at a time, should we say, Dr. Michael Obeng, their plastic surgeon, as well as philanthropist, just speaking to us about Restore.